Hi, my name is Lorenzo Cohen. I'm professor and director of the Integrative Medicine Program at the University of Texas MD Anderson Cancer Center in Houston, Texas. So the past 20 years in integrative oncology in particular has really been transformative. Back at the end of the 1990s, integrative oncology was a term that wasn't even used. We used the term alternative medicine, complementary medicine, something kind of done on the side. In these past 20 years, in a number of areas, we have created as a field the evidence base that was necessary to be able to bring these treatments to primarily help with symptom control, relieve in some cases to help control disease and improve longevity, into the field to be accepted as the standard of care. And there's no better example than the ASCO guidelines and in particular the NCCN guidelines. And in particular, the areas of acupuncture and mind-body practices are in all of the NCCN guidelines for symptom management. And once you're on the guidelines, then it's incumbent upon the medical community to offer the treatments. And what we need to work on as a society is to make it required that insurance companies also reimburse these therapies for which there is the evidence because they're on the guidelines. So something like yoga, for example, is on the guidelines for every chronic symptom that a cancer patient experiences. And so this has been a huge success. And in some sense, the work is done on building the evidence base. Now we need to move it to the next level to make it available to all patients throughout the country within every medical system. SIO is my home. It's my academic home. Some of my closest colleagues are members of the SIO. It is a place where I feel safe in being able to share what we're doing. Very importantly, it's a place for us to learn from each other and to share successes, to share the challenges we had, to share the solutions, very importantly, because when we leave the annual meeting, we go back to our centers. But I always feel this connection, and I know that there's always somebody in the organization I can reach out to get guidance, to get input. And I think this is true for many people in the organization. It's a place where it can help them to be more successful in what they're able to achieve. And as we know, the whole, as it applies to SAO and many things, is more than the sum of its parts.